Hi, this is Dr. Roy Kim, and I am honored to have Ms. Nancy, who is a wonderful patient who actually had a deep plane facelift, neck lift, laser resurfacing, and actually fat grafting for facial rejuvenation. And she's agreed to talk to us because she wanted to share her experience with her procedure, selection, like which technique, what's best for her, which surgeon, the aftercare, as well as any advice she may have for you. So, Nancy, thanks so much for joining me.
Thanks for having me.
So, if you don't mind, tell us a little about yourself or where you're coming from in terms of your facial rejuvenation journey.
I would say starting like my mid 40s, right now I'm 52, I was noticing pronounced laxity in my neck, the jowling, the droopiness of my hoods. I always had hooded eyes, but they really started to get really bad. And I started with Botox, I did microneedling that helped a little, but obviously it's not a long-term solution. So I started looking into facelift. At that point, was not aware that there is a type of a facelift, which is the deep plane facelift. I was only aware of the classical, windswept facelift. So I was very, very happy to learn about this type of a facelift because it just rejuvenated you and it didn't make you look different. And then all I did was I started following different surgeons on Instagram and TikTok. And over time, I got a pretty good idea of what it would entail. At one point, and I was really probably doing research for about 3 to 4 years and following the surgeons for 3 to 4 years, and I came upon your account as well. And I really like what you presented, and I felt very confident. I did do consulting with different surgeons, but in the end, I always came back to you because you really answered all my questions. I never felt like I was some sort of patient that was just part of the process and I was just supposed to fit a mold and that's it. You really listened to me, and that's what was very important to me. Also, you answered all my questions and any questions I had, after our initial consult. So that made me very confident and I was ready.
Well, thanks for the kind words. And as you know, every surgery is very personalized, but facial rejuvenation is extremely personalized because, yes, we could do stuff to the face, but what exactly? And for the neck, but what exactly? I know that you do some of the surgical details, which we'll get into in a bit, but you had some fun-filled questions for me afterwards. Like, did you actually do like submandibular gland resection or not? Which an average patient would not ask me, but you're so
Yeah.
educated that that's what we did.
Yeah.
So,
Yeah. I'm a bit of a nerd. So when I was young, I once considered going into plastic surgery, but obviously I didn't. And so I was very interested in knowing exactly what you did or how much you of the skin you took off because it's me, it's my stuff, it's my skin, my face, and seeing the result, the before and after, I was like, wow. So what exactly was done and how much was taken away? That was pretty cool. So.
and then when you started on your journey, what bothered you the most? Like your face, your neck, your skin quality, pretty much everything?
So the first thing I would say that bothered me, that was most visual to me, was the neck. And there was laxity, but there was also these, I don't know what you call these, but it was like skin that was like hanging like this. There was jowling happening. So I would say probably the lower half of my face was what I was most unhappy with.
Yeah.
Yes, I was also not happy with, the really bad hooding, but I would say definitely the lower half of my face and the neck. Yeah, because
Yeah.
everything was starting to get really like boxy, long, rectangular, tired. I looked super tired, even though I didn't feel tired. People ask me, "Oh, are you tired?" I'm like, "No, but maybe I should be feeling tired because everyone says I am." So yes.
Yeah, and so that's very common where patients have like a little loose skin, lower third of the face is what we call it, or I call it. And you're right, you start looking like rounded or box-like. You don't look like V-shaped anymore.
Yeah.
And that's an early sign of aging. And then I know we did laser, as you know. Plastic surgery, we can reposition things. We actually cannot give you better skin quality. And so you wanted that as part of your facial rejuvenation.
Yes, absolutely. I mean, I was already doing as much as I could for my skin, in terms of sunscreen, doing microneedling, just the classical microneedling, not the one with the radio frequency, which also does help a lot. But then again, nothing can beat a CO2 laser in terms of how much it improves the skin. So I definitely wanted to do that as well. And since I'm under anyways, might as well do the whole package.
Yeah. And then the nerd talk too, as well. A deep plane facelift does not go underneath the skin as far this way, which
Hmm.
means that we preserve the blood flow to technically a larger area of your face, which means that we can actually do CO2 laser, any laser, over a larger portion of your face. We feel very comfortable giving it in the middle. But once we hit the edges and we lift up the skin, that's where we start to back off a little as surgeons.
Yeah.
But the fact that there's so little skin actually dissected, in other words, lifted off and repositioned, we're able to give you like a wider area of laser rejuvenation.
Yeah.
And then I know that you traveled in from out of town. So how was that experience for you?
The experience was pretty good. I visited LA, so I had my surgery done at LA many times. I knew the area. I have friends there too. What was new for me is that since I was traveling alone, I had to book aftercare, which I had absolutely zero idea about what it entails, how it works, what it is. So I did book aftercare, and it was the best thing I could have done because after surgery, I was completely out of it. I could have not, kept track of what medication I had to take at what time. And thankfully, the nurses were there and they helped me keep the medications, give me the medications on time. And they even did things like braid my hair, which is really nice. Went shopping for me if food ran out, other little errands that they did. So it was really more like a personal assistant that is also a nurse that was taking care of you, which was great. Yeah.
Yeah, and that's really important. Definitely the first night or two, because you're waking up from anesthesia, you're a little out of it, and that really makes a huge difference.
Absolutely. So initially, I booked 48 hours of care, but
Yeah.
then I booked an additional 24 hours simply because I loved it. And it was nice to be pampered.
Yeah,
And and they are with you in the hotel room. So it's great.
that's
Yeah.
great. Now, you may remember right after surgery, we did a sliding brow lift. We did
Yes.
some facelift neck lift where you had some fun filled sutures all along these areas. How is that in terms of waking up and looking at all these temporary quilting sutures?
So, because I had been following all these surgeons for a while, I knew what to expect. Seeing it on yourself, I was more curious than anything else. I wasn't shocked because I knew what to expect. But definitely, I did have FaceTime meeting with one of my friends, and I told him, so don't be shocked. I'm going to show you my face. And he looked at my face, and all he said was, "Oh shit." I know we probably have to edit this out,
Yeah.
but he was not prepared for it. I thought it was funny. I did not feel bad in any way or shape or form. I knew these hemostatic
Yeah, yeah,
stitching,
hemostatic net, yes.
yeah, would come out. If anything, I was like, hey, I could play in an alien movie for a day. So that was fine. And the sutures around here and there, I mean, you can't
Mhm.
see these, but it was so inconspicuous. I was very, very happy and surprised. Yeah.
Good, good, yeah. Of course, as a plastic surgeon, we always pride ourselves on making sure they're hidden. But I think patients are surprised that they really, even right after surgery, they're sort of hard to see, especially the ones behind the ear. And then, how is your laser experience? Because what I tell patients is like, you're unfortunately going to be like a controlled burn patient for a short period of time. Your skin sloughs off, maybe not very pleasant, but when the new skin grows in, it's worth it. How is your experience with the pain control as well as the new skin growing in?
The pain control was not bad at all for the laser, really. The first day, it really felt like he had one of the worst sunburns ever. If you ever got a sunburn, I don't know if nowadays people have sunburn still because everyone uses sunscreen, but it's a really bad burn. The second day, it's about half as bad, and the third day, you practically don't feel it anymore. So it's not bad at all. It's just you're very red, obviously, and you are covered in Vaseline. And if anything, the Vaseline is the annoying part and not the laser itself because it gets everywhere. And you have to keep your face moisturized so everything is nice and moist. So that is probably the most annoying thing. The other thing that did surprise me, the marks of the laser, so the redness, did take longer for me to heal than I thought it would. I seriously thought it would take maximum 2 weeks, but you could still see some laser redness
Yeah, yeah,
longer
yeah.
than that.
Yeah, yeah.
But nothing that you can't cover with makeup, so that's not a problem. I was just a little bit surprised about that because I didn't expect it, but it's nothing that would bother me. So,
Mhm.
yeah.
How did the pain of the laser compare to the pain of the actual surgery?
Oh, negligible. Absolutely. And even the pain of the surgery is not bad at all.
Yep.
So I don't know if anyone had an ACL, torn ACL. That is terrible. The facelift surgery, it felt more like very tight, slightly banged up. That's it. There's
Yep.
no sharp pain, you know, limited movement because everything's very tight. You can't open your mouth quite as much. You can't really chew hard, but every day gets better. And the best part is, yes, I was swollen, of course, but the bruising, there was hardly any discoloration. There was some like over here and a little bit over here, but just slight yellow. I get more bruised if I hit my knee somewhere on a quarter, you know? So I was pleasantly surprised. You know, I was really expecting the worst, and it was really a ride in the park,
I think you're a
honestly.
great patient and you followed all the instructions of
Yes,
elevating your head, icing.
yes,
Yeah.
absolutely.
For the audience out there, in terms of pain, we definitely have better ways to reduce pain. So, specifically, there's a pain pill that actually works quite well, very strong, but doesn't affect your central nervous system. So, in other words, you don't feel sleepy, loopy, nauseated, and it still works well. So, that reduces pain. And then I'm able to give long term, like about 72-hour, 3 days worth of pain injections. Patients are asleep, of course. We're all done with the operation, but I'm able to give shots of 72-hour numbing to specific areas of your face, which also reduces pain. And then all that really helps. And then the deep plane method really also helps, again, more targeted, less dissection. And so the less dissection I do, the less bruising you have, the
Mm,
less swelling you have. And so I'll get into that's probably another topic. I don't know if you want to hear about it, but there,
absolutely.
okay, well, then I'll torture you and I'll torture everybody out there. There's like ways to actually do less dissection and still get the same, and I would argue better result. And this is not my original thought. I've actually stolen this or learned from it from other facelift plastic surgeons.
Mhm.
But classically, when we're doing the neck, especially, we want to actually classically, and I don't do this, a lot of people don't do this. You make an incision here, you go underneath the skin, you definitely go underneath the skin from this direction and from the middle, and you really do lots of dissection to separate the skin from your neck muscles and from the fat here and from the deeper structures. And that way, we can reposition everything really great. Well, there's a problem. If you lift up the skin that much, you're actually creating movement. The more dissection, the more bruising and swelling. The more movement, the more potential seroma fluid can occur, and you sort of feel it. What other people have thought about, and I totally copy, is that if you do a limited neck dissection, you have to do stuff to the neck bands here. You have to get to the deeper neck structures here. But this is a confined area like in the middle. I do have to come in from the side to reposition the muscles, the neck muscles and the skin. I don't have to go all the way across and connect it to this area here. So this area here, we
Mhm.
don't do dissection anymore.
Mm,
So that
okay.
way, when we reposition the tissue, it's still gripping, if you will. It looks more natural. It gives you a sharper jawline. I have not done the dissection, so I've not separated the skin from the underlying tissue. By default, it's not like you can really bruise or swell that much here because I haven't touched it. So that way, you actually get a sharper jawline, slightly less time in the operating room, although that's not the point because I don't have to dissect here. But also, you just simply have like less swelling there, period. And that's like the concept of like anatomy and more targeted dissection. We've always tried to do this as surgeons, no questions about it, for every procedure we do. But with the neck and face, we're actually able to achieve natural results with less dissection, less pain, quicker recovery. Is like the best of everything.
Yeah. And that totally now explains also why there was really minimal yellowish bruising here.
If you
Hardly
come see me,
anything.
yeah, if you come see me a couple years ago, you would have had like more swelling, potential bruising in this area. Since
Mm,
we're no longer dissecting, we're able to get a nice sharp jawline, but no technical surgery there. It's
great.
fun.
I'm happy. I got the best.
That's right. Now you're several months out after surgery. How are you feeling?
I feel great. I can hardly, so There is some residual numbness, but it's like really pinpointed about here and here. This has almost completely recovered. I can feel it. It just slightly feels a little numb. That's about it. Here where the incision was, it's a little swollen still, but I can totally feel everything. So I'm good. I mean, I even thought the numbness would last much longer. And it's just gonna get better. So I
No,
think it's only been 3 months now. So
that's right. Yeah, it's only been 3 months. It has not been 6 or 12 months in surgery.
yeah.
Yeah. And so the numbness areas, obviously, they're getting smaller, like it's less
Yeah.
and less. Yeah, yeah, yeah.
Yes.
That's to be expected. When you're walking around with strangers and stuff, nobody seems to stare at you. Nobody really notices, correct?
No.
Yeah.
I mean, I do have surgical silicone tape that I sometimes put over here if I'm wearing my hair up. Otherwise, I just use the gel. But you can wear the hair down. The best part is, and I'm so happy about this, you can't really see the incision here because it's behind the hairline
Yeah.
here too.
Yeah.
So I even have like a little bit of tuft still here of my sideburns, which is
Yeah.
great.
Yeah.
I
Yeah.
love it because that was probably my biggest fear is that you would see the incisions here, which is a dead giveaway, obviously, for a facelift. In the back, you can camouflage it really fine. No one noticed. Absolutely
Good.
no one noticed. Only two
Great.
friends. I've told two friends that I had facelift and they can't tell. All they're like, wow, you just look like you had a major vacation and look totally like refreshed. I'm like, yes, thank you. It's
That's
exactly what I
great.
wanted. But none of my other friends noticed. They're just like, hey, you look great. Your vacation was good. I'm like, yes, vacation was good. I didn't tell them I
I
had
had a minor
facelift
procedure or two.
vacation.
Yeah, yeah, yeah. Yeah, no, that's wonderful to hear. And
Yep.
then, is there anything about your overall journey that surprised you?
The biggest surprise was the lack of pain. And I'm very happy about that. I was prepared for the worst and I got a walk in the park. And that's great in terms of pain. The other part, what I loved was yes, you're swollen when you wake up. The swelling takes a while, several weeks, I would say 2, 3 weeks for you to really realize how much was done. But you can easily go out after, I would say, 3 to 4 weeks and people wouldn't notice. And I like that the most, I would say. It's how fast everything was, how little bruising there was, how little pain there was, and the results. The results are great. I look myself. I just look refreshed and a little younger than, before. I don't look as tired,
That's good.
which is, I love it, and just seeing myself in the mirror, looking not tired makes me have a lot of energy. It's like it has a real big psychological effect, which I think a lot of people underestimate. I saw myself before surgery every day in the mirror, and I'm like, oh, I look so tired, but I don't feel tired. And then all of a sudden you feel tired because your brain is trying to, make itself think that what you see is what you are. Just like how they say, keep smiling and one day you'll feel happy. Well, if you keep looking at yourself and you look tired, you are going to be tired, even though you didn't start out tired. And the exact opposite is true. You look at yourself, you look refreshed, not tired, and you got a lot of energy all of a sudden. So that is what I love most about it too,
Oh,
apart from the actual, physical part.
that's fantastic.
Yeah.
For all the people out there who are thinking about a facelift or neck lift, but they're scared, what would you tell them?
Best decision of my life.
Hmm.
Absolutely. If you're thinking about it, do it. Do your research, find someone who you're very comfortable with, who, showcases their work, who answers all the question. Obviously, I love you, Dr. Kim. I
Oh,
can
thank
only
you.
recommend you, but everyone should do their own homework first before they make their decision. But if you are thinking about it, and I've thought about it for 4 years,
Yeah.
do it. It's the best decision of my life. There's new methods, there's new techniques, hardly any bruising, deep plane facelift. I love it. I can't believe I waited that long, basically.
Well, thank you for the kind words, and you're a fantastic patient. And yeah, you had a great result. Surgery went very smoothly. I mean,
Yeah.
you look great.
No, thank you. Thanks to you.
Oh, well, thanks. Any final words for anybody watching out there?
I would say if you are doing a facelift, I highly recommend booking aftercare, even if you're with a friend, because aftercare are nurses. They look for certain signs. Do you have a fever? Are things going the way they're supposed to? Is the medication the right medication? Your friend may be very attentive, but they're not a nurse. They don't have the professional training. And it's just nice to be pampered. So I definitely do recommend getting aftercare. That's the
Yeah.
one thing I can say. Yeah.
Yeah, even if patients are very experienced, we generally recommend a nurse for at least the first 24 hours or overnight because
Yeah,
it does make a difference.
it does.
Yeah.
Absolutely 100%.
That's about it for this video podcast. So thanks so much for joining me, Nancy. Thanks so much for
Absolutely.
answering the questions. And
Absolutely.
then you're a wonderful patient. You have a great result. Thank you again for the kind words. But yeah, this is why, I'm so glad that you decided to share your experience, not just that you're happy, but also to educate others.
Absolutely. I think there needs to be more people that actually share their story. There's still some sort of a taboo about admitting to I had a facelift done, but I think this taboo is getting smaller, thankfully, and it's more acceptable. And why feel unhappy if you can just do something and fix it if you have the means to do it?
I totally agree.
To each their own. If you're happy the way you are, of course, stay the way you are.
Yeah, we may both be a little biased, but yeah, I mean, if you can do something about it, might as well. Well, thanks so much and have a
Thank you.
wonderful day.
You too. Have a great day. Bye bye.
Thanks. Bye bye.